Many Americans spend thousands of dollars a year in health insurance premiums and copays, but a new report finds that all of that money does not necessarily result in better care. The U.S. ranks last for health system performance compared to 10 other high-income nations. And the report by the Commonwealth Fund ranked the countries based on access, outcomes, administrative efficiency, equity, and the care process. The U.S. ranked last or second to last in nearly every category. The only success was the American care process, and that ranks second because the U.S. health system reliably provides preventative care like flu shots and emphasizes patient safety. Well, the poor rating comes despite how much Americans actually spend on health care. The U.S. spent 17% of its GDP on health care in 2022, while, for example, Australia's #1 rated system cost only 10% of theirs. Reginald Williams joins me now. He is the Vice President of International Health Policy and Practice Innovations at the Commonwealth Fund. That's the group that actually conducted this survey. It is great to have you with us. So given that last figure on how much the U.S. actually spends on health care, why are our ratings on these outcomes so low?
Well, thank you for having me today. The reason the U.S. performs low as it relates to its healthcare system relates to, one, health insurance access. Not everyone in the United States has health insurance. The #1, all of the organizations that are a part of our analysis, they have health insurance. Not everyone in the U.S. does. Second is actually getting access to that care. Having a primary care physician that you can go to instead of going to urgent care or the emergency room is vital. Other countries like Australia and New Zealand have opportunities for you to go to after-hours care, care on the weekends. They even still do home visits in those countries. So there are ways in which you can access the care much better. And then third, I'll say affordability. The United States is the only country where you have individuals saying, I am not going to access care. I'm going to delay my access to care because I can't afford it. People are making decisions between food and prescriptions. And so we have an opportunity to do better if we make our healthcare system stronger and more affordable.
So that's particularly concerning because given that people come from other countries actually to the United States because in a lot of ways there are technological advances that are being had here in the American healthcare system. And in so many ways, it seems like the American healthcare system could be the envy of the world, but then there's all these ways in which our outcomes are failing Americans, especially when you're talking about people not making this choice between spending money on food or actually getting the health care that they need. So how do we solve that problem?
So I think you raise a really important issue. Care process, where the U.S. performs well, is a place where we do good. Once you're actually in the healthcare system, you're getting access to care, you're getting the important screening that you need for cancer care, or if you're getting a prescription and you're taking multiple medications, the pharmacist and doctor talk to you about how those different medications interact with one another so you can have good patient safety. So once you're in the system, you're doing well. But because of the inequities in our system, often people face discrimination. It can be hard for women to receive and get certain health care that they need. We also find that if you live in rural areas, having access to high-quality providers that can deliver the type of care you need to live a healthy life becomes very important. And so as we think about how we can make our system better, we need to, one, make sure everyone is covered. Two, make sure that people have access to care. Having a primary care provider, someone they can regularly engage with, is important. And then we need to limit things like out-of-pocket costs so that individuals don't face those burdens when they have to pay for the care.
All right, Reginald Williams, thank you.